तो कहाँ है यार? ज्वाइन करने में इतना दिक्कत हुआ अभी।
Dr. Shivani Bhardwaj, Webinar Coordinator and EC Member, UP Branch of AIOTA. It is an honor and privilege for me to welcome you to this webinar on sensory profile, which has been organized by UP Branch of AIOTA. On behalf of the organizers, I would like to express my most sincere gratitude for your presence in this webinar. A very warm welcome to Honorable Vice President AIOTA, Dean Accord, Convener UP IOTA, Co-Convener UP IOTA, and a resource person and dear students. Now, I would like to invite Dr. Pankaj Bajpai sir, Honorable Convener of UP Branch of All India Occupational Therapist Association, EC Member IOTA, for the welcome address.
Thank you, Dr. Shivani. Am I audible? Am I audible?
Yes, sir.
Okay, okay. So, so we are here to for this webinar on sensory profile, introduction, screening, and scoring and interpretation. I welcome all the dignitaries here. Our Vice President of IOTA is here. President of IOTA could not make it because the timing was quite odd for him to join. I welcome Dean Accord, Dr. Bijlani ma'am. I also welcome our co-convener of UP IOTA branch, as well as EC member of IOTA, and Dean Paramedical Sciences of Santosh College, Santosh Hospital, and Santosh University, deemed university rather. Dr. R.K. Sharma is here. I welcome him also. And I welcome Dr. Nitesh, who is our resource person and who will be delivering his knowledge about this updated version of sensory profile, which we have decided to. Then I also welcome Dr. Kapil, who is also here, is EC member of UP IOTA branch. My sincere welcome is for all the participants here. Many students have joined from Santosh College. Because of their high number of registration, although the eagerness to registration was quite observable, but eagerness to join is not seen by the registered member. And such a large number have registered that I had to stop the registration at one point of time, rather earlier than last date. But now I am seeing that people are joining very casually. So such enthusiasm is not being observed here. But anyway, whosoever is there, all are welcome. All participants are welcome, because your presence is always make a program successful. And I feel that gradually, because it is Sunday, so gradually everyone will join. So my heartiest welcome to all. And I also welcome our coordinator of this all arrangement, Dr. Lakshmanan, who is sitting in Bangalore and arranging everything. And because I requested him, because numbers are very large, so do something. So he arranged for a live YouTube also. So that is being also published. And our coordinator of this program, Dr. Shivani Bharadwaj. So I welcome her also in this program. So thank you very much. So Dr. Shivani, you can continue. Thank you. Your voice is, yes. Unmute yourself, Dr. Shivani.
Thank you, sir, for having welcome address. I'm very much delighted to call upon Dr. R.K. Sharma, sir, convener, UP branch AIUTA, EC member, All India Occupational Therapist Association, for his address to the participant.
Thank you very much. Am I audible?
Yes, sir.
First of all, it's my moral duty to congratulate Dr. Bajpai, who has initiated on this topic during the Autism Month. It is very much apt, and it was very important also. Santosh students were very much enthusiastic, as Dr. Bajpai has said. They were after me that we want to attend it. I hope they will be attending it, slowly. And but the main important issue is that this autism, if you see that the gravity of the problem, the World Health Organization, it says that 23 cases per 10,000. That is a WHO survey of the world. And in India, if we see that also it is round about 23 cases or 22.3 cases per 10,000. And what I feel with my little knowledge about autism, that autism brain works in a different way from other people. They are not abnormal, You can't say it's a illness or some disease. They differently they are. And the autism is a processing difference that can have an impact on many areas of person's life. There is no typical autistic child. You can't put it into the framework. And every autistic child has their own strengths, differences, and needs, their own life journey also, and their own unique story also. So all these issues are so important and I think deep-rooted, that today I'm very, very delighted to have with us Dr. Nitish Srivastava, who has got extensive experience about autism and his interest also. And time and again, we have discussed with him on these issues. And today he's with us. And I'm sure and confident that he will be throwing, along with his expertise, but these points also, that why is it important to meet the sensory needs of an autistic child? Whether it's really important to meet the needs of the autistic child, what is the purpose of sensory assessments? And what does sensory have to do with autism? And is sensory good for autism? These are few points which were in my mind to share with Dr. Nitish. And along with this, I'm confident that he will be throwing light on other issues also related to autism. With this, I thanks to the organizer, convener, and also my deepest regard to our Vice President, Dr. Meena, Madam, Dean Accord Jyotika Bijlani, Nitesh, Dr. Shivani, and all the other senior persons. Thank you.
Sir, for sharing your word of wisdom with us. Now I request and I invite Dr. Jyotika Hindustani, Dean Accord, to address participants.
I think it was you have invited me because I could not hear properly. Maybe there's a problem with my mic or something. but I could read my name through your lips. So I think, yes, I'm supposed to talk. Thank you. So thank you, all of you. And I should first let me congratulate all the team members, uh, particularly convener and the co-convener and all the EC members who have organized this. So this is on because I'm Dean of Academic Council, so I feel very nice. I feel very glad and happy whenever any academic events happen. So and that also today's topic, which is close to my heart, that is sensory issues or sensory profile, that is assessment, interpretation, and all those things. So I just want to just little bit that it may not be necessary that only autism. It can be sensory. These issues can be having, with other children also. Cerebral palsy also can have many, but yes, it is more common in autism. So maybe you have chosen the right time to have this topic. But only one complaint I want to say. I saw Dr. Nitish Srivastava's qualifications. He has written only MOT. I want to say that you should be proudly writing the fellowship. You have received the fellowship in advanced, that also in advanced occupational therapy, that also in developmental disorders, which is the topic today. So I'm sure, Nitish, you are hearing me and you are going to change it. And when somebody, whomsoever is introducing it, please say that not only MOT, but he's also a fellow of fellowship, FAOT, that is in neurodevelopmental disorders. So on behalf of All India Occupational Therapy Association, on behalf of Academic Council of Occupational Therapy, I welcome you all. And I'm sure this is a topic which is very interesting. And in fact, those who are not much aware of it will enjoy it. So all the students, all the therapists, I'm sure you will all enjoy. And I'm thankful to all of you to invite me for today's event. And that's it. And I'm sure, Nitish, you are going to do the best. He was I was his mentor when he was doing his fellowship, and he is very hardworking, and he was doing so well that I don't think he never got any somebody complained about him that he's not doing so well or something. He's very sincere and doing his job. And I think in between I heard his interview also in YouTube. He did the interview was great. He spoke so well. So I know you all are going to learn a lot, particularly all the students and others who are going to hear that. So thanks a lot. Thank you, Shivani, and thank you all.
For your influential message, and we are charmed by your words. Now I invite Dr. S.K. Meena, Sir, Vice President, AIUTA, to address participants.
Thank you, Shivani. First, I thank you very much to convener UP branch, Pankaj Vajpayee sir. He was my teacher, my guide, my mentor. Today I am here because of sir. Sir always guide me as on today also. So on behalf of All India Occupational Therapy, I congratulate to all Dr. R.K. Sharma sir, Dr. Jyotika Bijlani, Dr. Nitesh, and Dr. Shivani, and all delegates, participants attending this program. And today's speaker, Dr. Nitesh Kumar, he's very cool. I have met to him so many times, but he's explained very well. I have first time meet in Delhi in the conference. So he explained is very well. He's also working in the clinical setup, not in academic, I think, but to grassroots level. So even today topic is very good, sense integration. Most of the autists are working in this field, sense integration, and he's also very good experience. So I hope all participants will enjoy this workshop, webinar. So thank you very much. Thank you.
for your valuable words. Now, I call upon our esteemed resource person, Dr. Nitish Kumar Srivastava, in charge Occupational Therapy Unit, DPMR, KJMU Lucknow, and EC member of UP branch AIOTA. Dr. Nitish has postgraduated from SV Nirpal in 2008. He has done fellowship in advanced occupational therapy, NVD, and has certification in handwriting without tears, and have various publications. So, over to you, sir. Sir, unmute yourself, sir.
Hello.
Sir, sir.
Hello, am I audible, sir?
Yes, sir, it is audible.
Yeah. Thank you, Dr. Shivani. And first, I would like to thank Dr. R.K. Sharma, sir, for your kind word for this webinar. Dr. S.K. Meena, sir, thank you very much, sir. And Dr. Bizlani, ma'am, no doubt, ma'am, I am very proud to say that I have done fellowship in pediatric occupational therapy, and I have mentioned here also. I think somewhere it's missed, but I have mentioned. And no doubt you are my teacher, ma'am, and I really appreciate your effort. And lastly, I would like to thank Dr. Pankaj Bajpai, sir. He has suggested the topic for the presentation. It's a very important topic for nowadays. And thank you, Pankaj, sir, that you are doing a tremendous job for standing of our UP branch of IOTA. Thank you very much, sir. So I am going to start my presentation. The topic is sensory profile, the latest version. Is it okay?
Yes, fine. It's okay. It's okay.
Okay. So good evening to all of you. And I also welcome all of the participants on the behalf of UP branch of All India Occupational Therapy Association. The topic I am going to present is the sensory profile. This is a very important tool, as we know that sensory profile is a standardized tool, and even most of the occupational therapists who are working in pediatric setup are using it nowadays. It is very important, and it is very easy. Why we are using it? Because it is very easy to administer. It will take only 5 to 10 minutes or hardly 15 minutes to administration. So we can easily do it in our regular clinical practice. This is an overview of my presentation. I will talk a little bit about introduction of sensory profile. And there are some item which is new in sensory profile 2, that is included in sensory profile 2. What is the theoretical foundation of sensory profile? How to administration and scoring. I also added few of the case reports so that we can better understand that how to score and how to compare it to the normal child. And I also mentioned some of the Indian study where sensory profile is used. So coming to the introduction, the author is Winnie Dunn. She is a very renowned occupational therapist, and she is a researcher also. She published sensory profile first, that is the original value of volume of sensory profile in 1919 in Journal of Psychology. That time the age group was 3 to 10 years of age. And sensory profile is a standard method that measures the child's sensory processing ability and the effect of sensory processing on the functional performance of daily life of a child. So this sensory profile not measures only the sensory processing, difficulty, but it also measures the behavior of the child and its function in daily activity. So that's why that makes it unique tool. It was revised in 2014, where some of the lesser important questionnaire was removed and some new questions were added. So this is the overview of sensory profile 2. The age range is already expanded. Now the age range is birth to 14.11, nearly 14 to 15 years. The administration option was paper and pencil, or you can do it by online through Q Global. It's completed by caregiver or a teacher. Either parents can complete it, and if I talk about the school companion, the teacher can complete this questionnaire. A scoring option is manual scoring or Q Global. So what is sensory profile 2? As I said, that sensory profile 2 helps identify the effect of sensory processing on functional participant in a child's in different contexts like home, school, and community. There are a number of judgmental based caregiver or teacher questionnaire. Either parents who is regular contact with the child can fill the form, or a teacher who knows the child very well can complete this questionnaire. There are a number of responses. This pattern of responses indicate the child's sensory processing pattern. It considered a broad domain like sensory system, that is sensory processing problem. There are behavior pattern, sensory pattern, and school factors. School factors only in school companion. So these are the some forms. You can see there are different forms, like 5 forms are there. And all forms are color coded. You can see it easily that first one is orange color, second one is purple color, another one is green and pink. So that you can easily identify, like this orange color is for infant and this blue color is toddler. So if you are working with a infant or toddler, you can easily grab it. There's no need to go to the text that which one is for a toddler or which one is for infant. So you can easily identify it. That's why it's color coded. The age group for infant sensory profile is birth to 6 months, toddlers 7 months to 36 months, and child sensory profile, short sensory profile, and school companion is 3 to 14 years. The adult sensory profile is not revised. It is 8 like the previous one, and the age is 11 years and older. So where we use the SP2. The first one is the data provides a vehicle for discussion. Discussion means we can easily discuss that where the problem lie, like in a sensory area or in sensory processing or is behavior. And this discussion will help different information for intervention planning. The data are also combined with other data. You can compare with the other sibling to see whether the differences is there or not. And one important thing that in DSM-5 criteria for ASD is that manifestation of hyper or hyperreactive to sensory input on any stage in sensory aspect of environment. This is given in DSM-5 for diagnostic criteria for this autism. This sensory provides a database base to document this criteria on it. So that's why it is very important tool, and by which you can diagnose the autism also. So what is new in the sensory profile 2? That is different from the original value of original sensory profile. So see, now there is only one kit with one manual. Initially, when first part was there will be different kit. You have to carry different kit or different manual. But this time only one kit and one manual. That is for infant, toddler, child, short, and school companion. The age range has already expanded, as I said earlier. Now the age range is 14.11 for child, school companion, and short form. Administration time is shorter because the number of questions has been reduced. If you remember the previous one, the child sensory profile, the caregiver questionnaire, where the total number of questions was 125, but now it has been reduced and the total question is 86 only. Similarly, in infants, now in sensory profile 2, the total questions are 25 instead of 36. In a school companion, it's a 44 instead of 62. In short form, it's a 34 instead of 38. So the number of questions has been decreased. That's why now it takes some little time. Infant and toddler record for nouns on two separate forms. See, initially when sensory profiles come, the infant and toddler sensory profile was in same booklet. In one side, I have that booklet. I can show. See here in this side, you can see this is infant or toddler, and the other side you have toddler. So in a one questionnaire, you have both. But now in sensory profile 2, this has been changed, and this has been changed, and there is a separate forms for infant and toddler. So what is new in sensory profile 2? Now we can score it online via Q Global. I will talk about that Q Global. There is no separate score sheets is needed because a score summary is included in the last page of questionnaire. Even the typical performance score is also there, so you can compare it easily. So there is no need to manual to compare it. So this all is given in the questionnaire itself. Questions were carefully reviewed to improve readability. As I said that some less important questions were dropped out. There are some questions that has been added in the sensory profile 2, and some question has reworded to make it more easier for the parents and teacher, so they can understand it easily. I will talk some example in the next slides. The validity and reliability studies have been increased, and this gives a comprehensive view of the child response across different settings, like in community, school, and in family. So there are 5 different forms, as I said, and they all are color coded. Even each single item in this questionnaire in sensory profile 2 is color coded, and quadrant are also color coded. So you can easily find that which item is responsible for this quadrant. I will show you, like you can see there. Question number 76, you can see there, misses eye contact with me during every day interaction. This is a question, and you can see here the purple color is for registration. See, this is icon, that is registration. And in next slide, you can see the purple color is responsible for registration and bystander. So these are the questions that is purple, that is in purple color, directly gives to the registration problem. So you can easily find it by looking the question only. See, likewise, 82 question, that is SK. SK is for seeking. So this question is responsible for seeking. So likewise, you can easily find it. This is a very new thing which is added in sensory profile 2. The scoring system is totally reversed in sensory profile 2. If you remember, in sensory profile first, it is 1 for almost always and 5 for never. But in this sensory profile 2, almost always is 5 instead of 1. And one more thing that has been added in sensory profile 2, that is doesn't apply, and the score for doesn't apply is 0. Suppose if a parent doesn't understand the question, that what exactly is this question mean, so where they can add this doesn't apply, where the score will be 0. So this is a new rating system. You can see there 5 is almost always, that 90% or more time if the child is showing particular behavior. 4 is frequently, 3 is half the time, 2 is occasionally, and 1 is almost never. This is reversed in this sensory profile. You can see here, this is the old one, the original issue of sensory profile. Here you can see there is no color code that was mentioned in sensory profile 2. The only thing that is given here is H and low. H is for high threshold and L is for low threshold. But in sensory profile 2, as I said, you clearly indicate that this question is responsible for which quadrant, like registration or seeking or avoidance or sensitivity. So this is a very unique item and new thing that is added in sensory profile 2. I also found something when I was going through internet to see what uh, uh, exactly item is in sensory profile 2. So I got that in infant sensory profile, there are few questions, like 52% questions are repeated from original. So these are the question which was in original, and these are the question which is used in original and sensory profile 2, and this is the new item that is added in sensory profile 2. Remember, I'm talking about the infant sensory profile. I have only data of infant sensory profile. And as I said, there are some modifications. Some questions are changed. It is used in original version, but it is rewarded in the sensory profile 2 version, that it acts in a way that interfere with family schedule and plans. Another question that is rewarded is the child had difficulty getting to sleep and is easily awakened. This is in original version, but here it is again rewarded, and it's very easy now. See, it's very easy to understand that child requires help to get to sleep. So parents can easily understand it. So few items are rewarded and few have been totally changed. So these all are the new item which is added in sensory profile 2, like need the same routine to stay content and calm, sleep more than other baby, and only pay attention when I touch my baby. If I talk about the tactile version in sensory profile 2, so here you can see the new item which is added in SP2, need to be swaddled or wrapped to relax and is startled by texture differences, for example, on grass, on carpet or blanket, and become upset when having nails trimmed. This item is used in both of the volume, and this item which is only in original version, is not in SP2 version. Now coming to the theoretical foundation, theoretical foundation is very important to understand the child sensory processing problem. That is also known as a Dunn model, that was given in 1997, and Dunn model presents the behavior response to the sensation, the child response to the sensation. It provides assessment and intervention strategy for the child. It was given that 4 basic patterns of sensory processing emerge from the interaction between neurological threshold and self-regulation. There are 4 basic patterns of sensory processing. Either it could be active or passive, that emerge from the interaction between neurological threshold and self-regulation. So what is the neurological threshold? First, we should understand what is neurological threshold. It's a personal range of threshold for noticing and reacting to sensory stimuli. See, this neurological threshold is vary person to person. I would like to give an example. Suppose you are very fond to listening a music, and आप रेडियो में FM चैनल सुन रहे हो, और सपोज करो कि आप 105 या maybe Radio Mirchi, that 98.3, you like to hear it regularly. So the particular song means Radio Mirchi will come only on 98.3 frequency, not either in 98.2 or not either 98.4. So this frequency is, you can show neurological threshold where the sound comes. So, and as I said, this vary person to person. The child react only on this neurological threshold. It could be either low or high threshold for the child. If a child has low threshold, passively they show the sensory sensitive behavior, and actively they show sensory avoiding behavior. I will discuss this also in other slides. And if a high threshold, then passively the low registration and behavior brain encounter threshold in active from the child will show the seeking behavior. The clinical profile for sensory profile 2, see sensory profile is in a broad spectrum. Even in autism and Asperger's, it was seen that more likely to exhibit behavior in sensory seeking, low registration, and sensory sensitivity, especially sensitive to auditory and oral motor input. So in autism cases, the problem area will be sensory seeking, low registration, and sensory sensitivity, especially sensitive to auditory and oral. As we know that in autism, there is a oral sensory issue. The child has a sensory seeking behavior. The child is roaming here and there. Sometimes it's a low registration, that child misses sensory input, and sometimes sensory sensitivity, the child showed defensive behavior. In attention deficit hyperactive disorder, ADHD, there was seen that there is differences across all quadrants, maybe more reflective of a modulation problem. In older adults, there is low score on sensory seeking and high scores on low registration, with cumulative higher score as people age from 60, 70, and 80. So administration and scoring timing, as I said, it's a very easy question, has been reduced. So it takes only 15 to 20 minutes to complete it. So scoring and administration, you can do by paper and web-based administration. Infant sensory profile take only 5 to 10 minutes to complete, toddler 10 to 15 minutes, and child sensory profile 15 to 20 minutes. Short sensory profile will also take 5 to 10 minutes, and school companion 15 minutes. And scoring will take only 15 to 20 minutes, where you can score and interpret the data, and you will easily find out what in which area the child has a problem. So what is in this sensory profile 2? See, the score is in different form. First is sensory system score, second is the behavior, then you have to find out the quadrant, or if it is school companion, then the school factor also. So here, give a look to this sensory profile 2. So this is child sensory profile 2. The age range, you can see this is 3 to 14 years of age. So whenever you start filling it, first you have to mention the child chronological age. So first is the test date, you have to enter in which date you are going to test here, and birthday of the child. Then child first name, is last name, completed by the caregiver, and what is the relation of the child with the caregiver. And also one new thing that is mentioned in sensory profile 2, which was not in the original version of sensory profile, that in what order was your child born in relation to sibling, whether it is the first child, second child, or third child. So this is a new thing which is added in sensory profile 2. And have there been more than 3 children between the age of birth 18 years? This is also a new question which is added in sensory profile 2. So here you can see the question is in first in sensory processing, like auditory. As I said, that you can see here, this is color coded. All the questions are color coded, and that is responsible for particular quadrant. So first is auditory processing, that is related to the sound, visual processing, that is related to the vision. And third one is the touch processing, then movement processing, which is for vestibular. See, in movement, there are lots of sensory seeking. Body position and body position processing, and then oral sensory processing. After that, the behavior will come, like the conduct associated with sensory profile, the social emotion relation, social emotional responses associated with sensory processing, and attention response associated with sensory processing. So the caregiver will fill this form, and you have to sum up all the questionnaire and find a raw score. What is the raw score? You have to find first one. And after that, this is for quadrant grid. where you have to mention the raw score of each and every questionnaire. And finally, you get a result.
Dr. Nitesh, sorry to interrupt you. Your slides are not moving.
Oh,
It is on the combination of sensory events. It is stuck up there only.
okay.
Combination of
I'm showing the sensory profile questionnaire. Is it not visible?
no. At present, it is combination of sensory events. It is shown.
Oh, I'm sorry.
So please check it. And
Actually, I have already hyperlinked it. So I don't know what happened.
you can reshare. Change it. Now it is changing. Yes.
Okay, I am coming from here because I have hyperlinked. I think it's not working. That hyperlink is not working.
Maybe.
Is it visible now, sir?
It is stuck up in slide number 22.
You have to reshare again.
You reshare. That is better. Stop sharing and then again reshare.
Now, sir, are you able to see the sensory profile questionnaire in my desktop?
But here it is not being seen.
Oh,
Sharing is not done. You stop sharing and then again do the hyperlink.
okay, okay. Sir.
And start with slide number 23.
Okay, and I can show from here. Now it's okay.
Yes. Now it is moving this.
Okay.
Now for
Actually, I
this
wanted
format.
to show this questionnaire. That's the
Yes.
problem.
Continue.
Sorry.
Continue with this.
So, yeah, you can see here, this is a child sensory profile questionnaire, and it's a caregiver question. Age is 3 to 14 years of age. And here you have to calculate the chronological age of the child. Like first you have to mention the test date and birth date of the child. What I said earlier, that there are new thing which is added in sensory profile 2. That is, what is the number of your child, in what order your child born in relation to siblings. This question was not in original sensory profile, but this is added in this question. And another question that is added in this sensory profile, that have there been more than 3 children between the age of birth through 18 years living in your household during the past 20 months? You have to answer in yes or no. So as I was saying that this sensory profile, there are questions based on auditory processing. And here you can see that each and every question is color coded, which directly tells that this question is responsible for which quadrants. So auditory processing related to the auditory issue like hearing, then visual processing, then touch, movement, body position, and oral sensory. So after that, there are behavior responses. That behavior which is associated with the sensory processing, like conduct associated with sensory processing, the social emotional response associated with sensory processing, and last one is the attentional. So these three things that directly show the child behavior. Here you can see, as I said, that scoring is 5 to 1. 5 is almost always, and 4 is frequently. After that, the very next page, you have to first you have to take the sum of raw score, and after that you have to mention the raw score here in each and every section of this quadrant grid, and you will find the sum of this raw score total. And now after that, when you getting the sum score, you have to compare it by this. Like here you can see the seeker is just majority is 20 to 47. If it is more, it come in more than other or much more than other. I will discuss this thing again in a case report. Now the slide is Cam sir. Hello.
Yes. Yes,
Now
Bob.
you have to share the presentation.
And now now it's showing my presentation PowerPoint.
No, sir, it's showing the same PDF. Now you have to stop sharing and then reshare the presentation.
Okay. Let me new share.
Yes, sir.
Now it's okay. See, so I have discussed about the sensory system score, then behavior, which I have shown in sensory profile 2, like conduct, social, emotional, and attentional. And now talking about the sensory pattern, which is a quadrant grid. So as I said in the theoretical foundation that was given by Dunn, that either the threshold will be low or high. If it is low, then the child response will be sensory sensitivity, and thus actively child will show the sensory seeking behavior. So sensory sensitivity means the child will respond to a low threshold in very less sensation. The child will respond to that sensation and easily respond to sensory stimuli, notice things other people don't notice, and highly aware of their surrounding and distractible. The child behavior is like that. This is the passive response. So take an example. Suppose you have mm, some pain in your hand, like you have a fracture in your hand, and if you are going to a crowded place. So what's your behavior? Clearly show that the sensitivity. तो आपका behavior कैसा होगा? Like अगर आपके हाथ में चोट लगी and there will be swelling, so you always try to avoid it from the other surface. So this type of behavior, child will show that this type of behavior, and this is known as sensory sensitivity. So in sensory avoiding, child actively counteract with a low shadow. बच्चे जो है वहां से भागना चाहेंगे, वो अपने आप को बचाना चाहेंगे. And intentional withdrawn or blocking of the sensation, use of rituals and routine, like child doesn't like to change the routine or overwhelmed by sensory rich environment. Now low registration or sensory seeking. If the child has a high threshold means the child, take another example. If high threshold, suppose in a winter season you are wearing some gloves in your hand, so it's a very difficult to manipulate the object with by hand when gloves is covered. So you have to manipulate it, or you have force it to find out that what it is. So what happens in same thing happened with the child with a high threshold. Child usually miss available sensory input because the child has need more sensory to make a response, and this is because child is a high threshold and उनको बहुत ज़्यादा sensation चाहिए और इतना sensation वो miss कर जाते हैं. The child will show spacey, clumsy, and child will the under responsive or slow to respond. Child is flexible, comfortable in wide range of environment, and the actively what child show, जब उनको sensation नहीं मिला तो क्या show करेंगे? So the behavior response जो होगा to counteract to high threshold, वो different तरह के sensory को enjoy करेंगे, enjoy sensory rich environment, create sensation, बार बार वो sensation create करेंगे so that कि उनको जो brain को चाहिए वो मिले. Easily bored, trouble tolerating low stimulus environment. Another thing that is included is school factor score. Again, I have to stop. Now you can see the school companion form. Hello.
Yes.
Yeah. So this is school companion that is for school going children. The age group is 3 to 14.1 year, where we can talk about the school factor like factor 1, 2, 3, and 4. So here also the test date and birth date and chronological age you have to find. Yeah, another important thing that you have to mention here, the name of the school, and please estimate the frequency of contact you have with the student, like child is 1 day per week going to school, or 2 days or 4 days or daily, and how many years have you had contact with the student. So you have to mention this thing. Teacher need to mention that whether they know child. So here also, first you will get the sensory processing like auditory processing. Here you can see the quadrant. Next one is the visual processing, then touch processing, movement processing, and next is the behavior. Directly come to the behavior response associated with the sensory response. And after that, here again, this is only 5 things. And here again, you have to take out the quadrant grid, like sensory seeker, avoiding, sensitivity, and registration. And here, whatever the score will come, you have to take total of the raw score and you have to compare. And this chart is for school factor. So school factor 1, known as a support. Here you can see that school factor 1, this factor reflects the student need for external support to participate in learning. School factor 2 reflect the student awareness and attention in the classroom. See, the school factor 1 is the combination of seeking and registration problem. Like if you see the questions carefully, the most of the question is related to seeking and registered problem. So the child behavior in either see, it is a high threshold. So the child will need external support, external sensory system to perform better in the classroom. So that's why this factor is known as support, external support. Second one is the awareness and attention. Second one, and this is the combination of seeking and sensitivity. So the child has a seeking behavior as well as a sensitivity behavior. So you need to observe carefully, and that gives the awareness and attention in the learning environment. The third one is reflect to the student tolerance, whether the student can tolerate the environment or not. So this is a low threshold, that is avoiding and sensitive. This is the combination. This score will come in the combination of avoiding and sensitivity. Okay, and factor 4, that is availability. This factor reflects the student ability for learning within the learning environment. And the quadrant is responsible for this is avoiding and registration. Okay, I'm again coming to my slide. Okay, this is the cut score. I have already shown it in the questionnaire, but here you can see this is the just like the majority of other. This is the score which is important for art. And if you more than this score, it will come in more than other, or it will if it is less than other, then it come in less than other. This is the cut score of the classification system. Here you can say this is the typical performance group, that is the same as other, and above this, like if it between 1 and 1 ST and 2 ST, then it will be more than or much more than. Sweden also reported in 2014 that just like the majority of other define the typical amount of sensory processing for each different categories. Low score on the profile is also important. It's also meaningful, just like as a high score. Any combination of score is possible. It is not necessary that it is not necessary that in auditory section child is showing hyposensitive, and in vestibular session it is showing hyper responsive. So any combination of score is possible, and different combination of sensory pattern can exist within one child, and that is in different situations. Suppose a child is child behavior in the classroom is different, and its behavior is in the room or in community is different. So combination of sensory pattern can be seen. So now coming to the Q Global scoring. See, this is reporting option in Q Globing. The score report will come, item analysis report will come, and assessment and planning report will come. And you can go in this www.helloq.com. But I tried it, but if you have purchased this scan and if you have license, then only you can access this Q Global scoring system. So where you have to answer, just mention the raw score, and the sample will, the Q Global sample will come like that, like the raw score, percentile range, and the classification. So each and everything will come out. There is no need to score it manually. Now coming to the normative information, this sensory profile 2, as I said, it's a very unique and very well established. So the study was used and the sample size was highest. I think 1,791 total children were included in this study. 337 children rated on both child and school forms, and 774 children with disability. Approx 10% of sample with disability, and data collect both digitally and paper pencil. If I talk about reliability, it's a good reliability. The caregiver sensory profile reliability is 0.83 to 97, which is very good, and school companion is 0.66 to 0.93. It is also very good. And inter-rater reliability is 0.17, 80 for caregiver, and 0.70, 80 and 19 for teachers. Validated studies, so it's a well valid tools, and its validity study was done on previous sensory profile, and this is behavior assessment scoring for children, PRS parent rating scale, and SP2. BASC TRS, this is social scale for improvement, and SP2. So its validity is quite good. The clinical comparison group was used, as I said, that autism, ADHD, dual diagnosis of ADHD, ASD, LD, intellectual disability, and Down syndrome. And infant and toddler form was also used in developmental delay cases. Now coming to some case study, I would like to, as I said, that I have mentioned some case reports so that we can easily understand it. So here you can see the test date is 24th March 2020, and the birth date is 24 April 2017. The age of the child is 4 years 11 months. The name of the child is Jan Pandey. He is 4 years 11 months, and it's the child is doing non-verbal communication. Sometimes he use pointing, or whatever he want, he can explain it by pointing. The parents' main concern, the child has a poor attention and poor sitting. So I use this sensory profile too, and here you can see the interpretation. In auditory area, the raw score is 20 by 40. So it is just majority of other visual touch. This all are majority of other. So I'm not going to discuss it more. But in movement, the score is 22, and it is more than others. You see, this is the typical range 7 to 18, and the child score 22. So in this section, the child is more than others. And in body position, which is proprioception, it is 18 to 14. It is also more than other. And the rest, all sensory area, the child show typical performance. I also did the conduct, the behavior sections, the conduct, social emotional responses, and attentional responses. In all these three sections, the child score more than others. And it's mainly because the child has a problem in these two, movement and body position area. And because of this, the child in quadrant grid, the child have a seeking behavior. You can see in seeker, the child has a more than other. In the rest, the child have the typical performance area. So this is the score. You can see it. I manually used to sum up all the score, like since is quadrant 1 is 58, 44, 42, and 41. I did it manually and compare it with this. So in conclusion, the child has a sensory processing issue in movement and body position, which gives the sensory seeking behavior. And because of that, the child has a behavior issue like social emotional response, conduct, behavior as well as poor attention. Another child is Das Pandey, because this child is going to school recently. He has started to go to the school, I think 2 months or 1 month before when school has started here in UP. This is the 5 years and 2 months and 70 days. He is in LKG, and the child is doing need-based communication. He can, whenever he needs anything, he can ask verbally. The teacher main concern, the child is not able to sit in the classroom. He usually jumping here and there, and child has a poor attention and concentration. So this is the score of Das Pandey. You can see here, the age is 5 years, 2 months. And also I said that in school companion, you have 2 different questions, which is added in sensory profile 2, that please estimate the frequency of contact you have with the student and 3 to 4 hours, because the child was going only 3 to 4 days. And how many years have you had contact with the student? To 6 months or less, because he recently is starting to go to the school. So this is the auditory processing. I wanted to show because this is the raw score of auditory. Here you can see the auditory processing issue. And now the sensory and behavior section. You can see the child has a problem in each and every section. The child score more than other with the typical performance. But in visual touch, the score is much more than other. Similarly, in quadrant, the child score more than in seeking, and much more than other in avoiding. In sensitivity, which is much more than other, and registration more than. The child has problem in each and every quadrant. So that's why when I added that, done already say in 2014 that any type of combination of result will be possible. So here you can see the child has problem in each and every read, in each and every sensory and behavior area. In school factors, because all the child have a problem in all the quadrants, so definitely all the school factors have a problem. You can see factor 1, that is much more than other. This clearly indicate that the child need additional support in the classroom to performing for learning. Factor 2, that is much more than other. Again here, because I said that factor 2 is seeking and sensitivity. So child need additional support, as well as they have to reduce some sensitivity because child is sensitive also. Factor 3, you can see here again is more than other. So this is a low threshold, like the child has avoiding and sensitivity problem also. And factor 4 also much more than. So the child is not available for learning in this classroom. So this school factor clearly indicate that the problem of child in the classroom. So here you can see how I calculated it manually. So this is all is quadrant, and this is a school factor which I have taken total score and compared it with this. So in conclusion, as I said, that the child has a sensory processing problem in each and every area, like auditory, visually, touch, movement, and behavior, and also in a quadrant. And because of this, they have a problem in all the 4 factors. School companion. Well, this is all about of the sensory profile 2. Here I have added some Indian study that whether that sensory profile is important for Indian children or not. So one study I got that is published in Indian Journal of Pediatrics, that is done by Benjamin Tanya in 2040. She validated the sensory profile caregiver questionnaire SPCQ on parents of 190 children with developmental disability. And in this study, she concluded that the sensory profile caregiver questionnaire has adequate psychometric property for use in the Indian population for identifying sensory processing dysfunction. So this is a study clearly indicate that sensory profile questionnaire can also use on Indian population also. Another study I have got that was done by Shah, Sonam, Pankaj et al. That is prevalence of sensory processing dysfunction and pattern on sensory profile of children with autism spectrum disorder in Mumbai, a pilot study done by Shah, Sonam, Pankaj et al. In 2015 to investigate the prevalence of sensory processing dysfunction in children with ASD in the urban Indian context and understand dominant sensory processing pattern. And they use toddler sensory profile questionnaire. And in this study, they saw that the prevalence of SPD in children with autism similar to finding in the previous published study. And they emphasized lastly that there is a need to assess sensory processing routinely as a part of occupational therapy assessment. So whenever any child comes to the autism spectrum disorder, we need to assess it by sensory profile. So this study emphasizes on this. Another study I got that is comparative study using the sensory profile by the caregiver on the performance of children with and without autism spectrum disorder. This was done by Tripathi et al. Jagdish Kumar in 2016, and they concluded that short sensory profile. They used short sensory profile in their study, and they concluded that SSP can be used as a satisfactory evaluatory tool to evaluate sensory processing ability of children with ASD, which can be really very helpful to occupational therapists in assessing and planning intervention. Another study also I got that is prevalence of sensory behavior in a normal Indian children with short sensory profile. This is also by Tripathi et al. Jagdish Kumar. The researchers have studied that a score of all items of short sensory profile, sections, and totals are different the other study, but the result are the same. This variation in score might be due to different cultural in the world. It creates a need to assess the expectation, perception, and view of the caregiver from different culture. This is all about, this is the references. This is all about the presentation. Thank you.
Thank you, sir. Thank you so much for sharing your deep knowledge about sensory profile with us. Your session was full of enthusiasm and valuable knowledge. Sir, we do have some questions. So there's a question from Monica. She is asking about the cost and availability and any specific for sensory profile.
Your voice is not clear. Come closer to the mic.
Is it clear, sir?
Not yet.
Sir?
Now it's clear.
Okay, sir. So we have question regarding cost.
Some net issue, I think.
Yes, sir. There is a question regarding cost. Specific training required for sensory profile.
Now I will take up the question. Dr. Nitesh, the question is from Monica Srivastava. It is she asked that what is the cost and availability of the questionnaire? This is number one. Any specific training is required for sensory profile 2? This is number two. Two questions are basically included.
The cost, I don't know about the cost. You can go to the Pearson assessment site where you can get it easily, the cost and what is the cost of this profile. And there is no need of training for this sensory profile. You can directly do it. If you have a manual or kit, you have to do it clearly.
And basically this question is to be filled up by the parents and teachers.
Yes,
So,
yes.
so question of training does not arise.
Yeah.
So much for
Dr. Shivani voice is not clear. I think there's problem in her mic.
Is it clear, sir?
Now clear, now clear.
Better to type, Dr. Shivani.
Now it is clear.
Sir, is it
Mobile connect kar lo.
yes, sir.
When you are turning your face to your left side, then it is clear.
Yeah.
Right now.
Yeah, clear.
Okay. So thank you so much, sir, for your wonderful session on sensory profile 2 and sharing your knowledge with us. Last but not the least, I invite Dr. Kapil Kumar, EC member, UP branch IOTA, to propose vote of thanks.
I, Dr. Kapil Kumar, EC member of UP branch of IOTA, thanks to our resource person, Dr. Nitesh Srivastava, for taking webinar on sensory profile and providing important information. And my special thanks to organizing committee, Dr. Sharma sir, Dr. Srivastava sir, Dr. Pankaj sir, Dr. Jyotika ma'am, Dr. Meena sir, and our webinar coordinator, Dr. Shivani, for all the coordination and support. And today, with my warm words and my kind message, we move to the end of the today's seminar. Thanks to all for coming again for the next session, which will be decided by Dr. Pankaj sir only.
No, 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 everyone is included. Dr. Shivani, can we have a photograph screenshot? You can request the participants to put on the video on.
Yes, sir. I just request participant to open their videos for a group set photograph.
Please open your video so that we can take the photograph, a screenshot.
I request participants to open their videos.
Shivani, you can take the screenshot. You can conclude the session.
That's it.
Now we can leave.
Yes, sir.